conferences like this today bring together the voice of young people who really know, and it brings together professionals, it brings together commissioners and GPs and policy people to really think about how we move forward and improve services and access to information for people, for young people, in relation to mental health.
I've been quite inspired by today's event, and mainly that we're trying to do exactly the same thing. We've got slightly different solutions and innovations on the edges, but the principles are exactly the same, and I find it quite reassuring that we're all heading in the same direction.
It's just really inspiring how everyone wants to work in partnership. I think that's the key thing, because that's how we work, and it's great to hear everyone else wants to do it too.
Here is a great place to kind of display the different ways that different organisations are working towards youth mental health services, and that's the main thing I'll take from here.
I've come today just to find out about what's going on within young people's mental health services. There's been a lot of change and a lot of new ideas and teams sort of coming together, so it's always good to meet other people who work in a similar service to yourself and keep up to date with what's going on and what could be happening in the future, really.
I think the most important lesson that I learn each time I come to one of these events is make sure you put young people firmly in the middle of whatever you're doing and don't start making plans and great sort of changes without involving them in it.
The one thing I get from this conference is the level of innovation that is being rolled out in pockets across the southeast. I think it's really fantastic work they're doing. I'd really love to see more of this being rolled out across more regions, because the new configuration of CCGs and the new landscape around mental health, we need to really push the boundaries, I think, because there's some fantastic work being done.
I think the main challenges surrounding mental health are really the taboos that are pronounced at the minute. I mean, as a young person, obviously there are a lot of issues that come out if you just say you've got a mental health issue, and I think, yeah, that's personally I experienced that was the main issue when it came to telling other people.
I think the main thing that I've learned is just that there are other areas doing very innovative work, so there's been huge amounts of learning from the other speakers who have been there, networking in relation to chatting to people about their projects or their hopes or their aspirations. And I guess one of the biggest things that I've learned from today is that it's not about reinventing the wheel, but there's lots of good things out there that can be borrowed and adapted and developed further.
To improve youth services, I think there's a very old school mentality on kind of mental health issues. Number one, there's not a lot of education in society out there, so doing everything possible to educate people out there, so it's not that taboo subject anymore. But as well as that, potentially getting young people to communicate with young people, or if not, finding effective ways to communicate to young people, i.e. through social media, or whether it's festivals or kind of in a more up-to-date way of communicating with people, which is technology, and that's the kind of format that I think that the NHS in general should